Welcome to my lifestyle medicine presentation on finding simple solutions to complex health problems. My name is Denise, and I am passionate about helping people to live longer, healthier lives. If we look at this first picture of beachgoers in the 1950s, we notice something rather startling. Most people were slim or slender, and it was rare to see someone who was overweight or even obese. Fast forward 70 years, and the number of people who are overweight to a point where it is affecting or will affect their health has increased dramatically. This increase in fat around the abdomen is a serious health issue and is often indicative of metabolic syndrome or METS. METS is a cluster of metabolic abnormalities that include obesity, insulin resistance, high blood pressure, high cholesterol, and elevated triglycerides. METS is recognized as a lifestyle disease. It is associated with dietary intake, insufficient physical activity levels, and increased sedentary time. So let's have a look at how serious METS is. METS affects approximately a quarter of all adults, many of whom are completely unaware of their condition. According to the World Health Organization, METS increases your risk of developing cardiovascular disease and type 2 diabetes. Obesity is a growing problem in China. Most of this obesity is caused by poor lifestyle behaviors that are estimated to globally cost $54 billion in direct healthcare and $14 billion in lost productivity. As the population ages, the economic burden created by chronic lifestyle-related diseases such as METS will continue to grow, putting pressure on China and other countries around the world to find affordable solutions to this major health issue. So is there a simple, affordable solution? What if your doctor, however, could give you a single prescription to help reduce the high blood pressure, high cholesterol, and insulin sensitivity, which are at the core of metabolic syndrome? What if this same prescription could also treat and help you manage these and possibly other health issues that you may have? Even better, what if this prescription was easy to get and completely free, and you could start immediately without having to wait? Oh, and I forgot to mention, it has no negative side effects and will leave you feeling and looking better than you have in years. Indeed, current medical research confirms that there is a natural and safe way to help prevent, manage, and treat lifestyle diseases, such as metabolic syndrome, that is grounded in evidence and that are highly effective. The answer is as simple as prescribing regular physical exercise. According to the Director General of the WHO, being physically active is critical for health and well-being. It can help to add years to life and life to your years. According to a series of papers by The Lancet, a third of adults and 80% of adolescents worldwide do not reach recommended levels for daily physical activity. Physical inactivity is responsible for 5.3 million deaths per year worldwide. If this could be decreased by only 10%, a staggering 500,000 deaths could be averted yearly. As far back as 2013, physical inactivity cost global healthcare systems about $53.8 billion worldwide. While inactivity is more prevalent in high-income countries, it has a more significant health impact on the low to middle-income countries that have less developed health support services. We have seen that although the leading cause of death in developed countries are predominantly physical inactivity-related diseases, a 2012 study on physical inactivity showed that physical activity or exercise could help prevent up to 35 separate pathological and clinical conditions. Any physical activity of any duration can help to improve health and well-being. While more is better, it's probably more important to start where you are and just get moving. If you must spend a lot of time sitting still at work or school, then it is vitally important you make more effort to counter the harmful effects of sedentary behaviours. If your levels of sedentary behaviour, that is TV and computer time, continue to be at a high level, your risk for METs increases. This is despite overall exercise levels being high. According to a report on sedentary behaviour in rural Chinese, watching TV is positively associated with high waist circumference and high triglyceride levels, which increases the chances of you developing METs. A possible way to improve outcomes is to incorporate light physical activity with reduced sedentary time. By reducing sedentary time overall, this is going to be more effective than engaging in moderate to vigorous physical activity with more extended periods of sedentary behaviour. So it's best to break up your time in the computer or working into parts with exercise in between. It is better, therefore, to get up and get moving as much as possible. The benefits of exercise are long-lasting and have multiple benefits. Okay, so a 30-minute walk can provide you immediate immune benefits lasting several hours. And older adults aged 65 years or older are advised by WHO to add physical activities that emphasize balance and coordination, in addition to those that strengthen their muscles. Indeed, a study on exercise in the elderly revealed that building their strength and balance helped to reduce the progress of osteoporosis and reduce the risk of falling. We can see that the benefits of exercise to prevent many health issues is evidence-based. But what evidence is there to show the benefits of exercise on the treatment and management of long-term and chronic health conditions? Type 2 diabetes is one of the many potential long-term conditions that can arise in individuals with METs. The prevalence of type 2 diabetes among Chinese is now 9.7% above the global average, with an average of 21% among adults. A 2021 systemic review and meta-analysis of the literature on the therapeutic effects of exercise on glycemic control in patients with type 2 diabetes showed that there were significant benefits to adopting exercise into a treatment plan for managing long-term conditions. These benefits range from improving glycemic control and insulin sensitivity to simply just improving body form and image. And sometimes you could see noticeable benefits with as little as 1 to 2 days of exercise. However, more significant improvement occurred when there was more frequency in the exercise. A second meta-analysis on exercise and type 2 diabetes, conducted in 2020, concluded that combined exercise significantly improved glycemic control, influenced weight loss, enhanced insulin sensitivity, and assisted with weight loss and control. Combined exercises included aerobic exercise that gets the heart pumping and oxygen circulating, and resistance exercises, strength training using resistance or tension. Aerobic exercise has an active effect on fatty tissue, the skeletal muscle, and insulin receptors. It thus improves insulin sensitivity and glucose homeostasis. Resistance exercises, on the other hand, can enhance muscle strength, insulin sensitivity, and muscle rehabilitation. While aging is a lifelong process characterized by progressive loss of physical fitness, compromising strength, flexibility, and agility, regular exercise can improve the quality of life among the elderly and help manage chronic health conditions. A comparative cross-sectional study revealed the importance of promoting moderate to vigorous physical activity practice amongst the elderly, thereby allowing physical fitness maintenance or improvement. Globally, populations are aging. Typically, physical activity levels decline and health worsens as we age. However, estimates on the impact of physical inactivity for population health often fail to specifically focus on older adults. Unfortunately, many older adults are not engaging in sufficient exercise. It is vitally important to promote exercise in the elderly to improve functions of daily living and slow the progression of disability and disease. Many older people, however, with long-term conditions, unfortunately have reservations about commencing an exercise program. If you have a long-term condition and are concerned about the risks of starting to exercise, have no fear. A study in Britain showed that if you have a long-term condition, provided you build up gradually from your current level, the benefits most definitely outweigh the risks. More healthcare professionals are aware that not only is increasing physical activity safe for people living with one or more LTDs, it is also a highly effective way to treat and manage many health conditions. A study on exercise and long-term conditions done in Oxford showed even frail, inactive people have much to gain from increasing their physical activity levels. You must, however, ask your healthcare provider for an assessment of your physical activity levels. This will ensure that you know how to exercise for your condition and age safely. We've shown that patients with METs and type 2 diabetes are at risk of developing cardiovascular disease and stroke. But are there ways to manage these diseases more effectively than with drugs? Existing randomized trial evidence on exercise interventions suggests that exercise and many drug interventions are similar in terms of their mortality benefits in the secondary prevention of coronary heart disease, rehabilitation after stroke, treatment of heart failure, and prevention of diabetes. These studies show that exercise is a safe and viable alternative to, or as a complement to, drug treatment. To summarize, we can see that METS is a serious health issue that has strong origins in a lack of physical activity. It is now widely acknowledged as a disease of lifestyle that will respond to lifestyle changes that are safe, affordable, have positive side effects, and are readily available to the majority of people. But that is not all. We've shown that the prevention of METS also helps to prevent a host of other diseases and is clinically proven to help manage and treat many long-term health conditions. Recognizing the benefits of exercise as medicine, countries around the world are encouraging health professionals to step up and promote exercise as the first choice before drug and surgical interventions. Exercise as medicine is an initiative of the American College of Sports Medicine. It has branches worldwide, and their websites provide a wealth of information in many languages. If you are Chinese, it's important to know that while China is a member of the global network of exercise as medicine, you may only find support material on the Hong Kong Exercise as Medicine website. So hopefully I have now inspired you to get out and get moving for your health's sake. Because the benefits of exercise to prevent and treat health issues are wide-ranging, affordable, and effective, it is important that we incorporate being active into our daily lives. If you are unsure of how much exercise you need and at what level to start, you can go to the Exercise is Medicine website for your country of origin to find the exercise guidelines applicable to your age, lifestyle, and gender. Fortunately, the increase in parks and leisure venues in China has improved over the last 20 years. Physical activity in China, especially among the growing numbers of elderly Chinese, has never been easier or more enjoyable. Thank you for attending my presentation.